He sat across from me in my office, a man named Robert, 68 years old, with the kind of hands that told a story of a life spent building things. Strong hands, capable hands. But in that moment, they were trembling, resting on his knees like two frightened birds. He wasn't looking at me. He was staring at a spot on the wall just over my shoulder, as if the answer he was dreading was written there. He had come to me far too late, and we both knew it. The journey that ended in my quiet, sterile office didn't start with a sudden sharp pain or a dramatic collapse. It started with something much smaller, much quieter. It started with a secret he kept from his wife, from his friends, and for a terrifyingly long time, even from himself. It started with a single drop, a tiny, almost unnoticeable pinkish tinge in his semen that he saw one Tuesday morning and chose to ignore. He told himself it was a trick of the light. The next time, a few weeks later, it was a bit more pronounced, a reddish-brown streak that was impossible to mistake. He felt a cold spike of fear, but he pushed it down. He reasoned it away. Maybe he'd been too vigorous. Maybe it was something he ate. Maybe it was just a fluke, a bizarre hiccup of an aging body. The price he would pay for that silence, for that willful ignorance, was a steep one. The cancer had been given time to grow, to weave its way deeper into his prostate, making the treatment more aggressive, the side effects more severe, and the future far more uncertain than it ever needed to be. His story, and the quiet regret in his eyes, is why I am talking to you today. Because the deadliest threats to a man's health after 60 are not always the heart attacks or the strokes you read about. They are the silent warnings, the ones we are too embarrassed, too scared, or too uninformed to acknowledge. I am Dr. Liam, and for more than 30 years, I have been a urologist, a specialist in men's health. I have sat with thousands of men like Robert, men from all walks of life, and I have seen firsthand how a simple lack of information can have devastating consequences. My mission, on this channel and in my practice, is to break the code of silence that surrounds men's health. We are going to talk about the things most doctors don't have time to discuss in a 15-minute appointment. We are going to talk about the things you're not supposed to talk about. Today, we are pulling back the curtain on one of the most critical and most ignored signals your body can ever send you. It's a signal that appears in the most private of moments, and it is the #1 sign in your semen that you must never, ever ignore. So I ask you right now to make a commitment with me. A commitment to your health and your future. Subscribe to this channel. Click that bell so you don't miss these conversations. This isn't just about watching videos, it's about building a fortress of knowledge around your own well-being brick by brick. The information we discuss here could genuinely save your life or the life of someone you love. The topic of semen is a sensitive one. For most of a man's life, it's associated purely with virility, with pleasure, with the creation of life. But after the age of 60, its role changes. It becomes something more. It becomes a vital barometer of your internal health, specifically the health of your prostate and the intricate network of glands and ducts that are hidden deep inside your body. The problem is, no one ever tells you this. No one gives you the owner's manual for an aging male body. You're left to guess, to worry in silence, and to hope for the best. And here's the hard part. This silence is dangerous. The signs and signals your body sends through your semen are often the very first whispers of a problem, long before you feel any pain or notice any other symptoms. Ignoring them is like hearing a smoke alarm chirp and simply taking the batteries out. Today, we are going to put the batteries back in. We will talk about what you need to look for, what it means, and precisely what you need to do, not tomorrow, but today. This knowledge is your power. It is your first line of defense. Let's begin with the most alarming and most important sign of all, the one that brought Robert into my office filled with regret. We have a medical term for it, hematospermia, but you can simply call it what it is, blood in your semen. This is the undisputed #1 red flag that you absolutely cannot ignore. It can manifest in a few different ways. Sometimes it's a bright red, fresh-looking streak, which indicates the bleeding is new and likely closer to the exit, perhaps in the urethra. Other times, and more commonly in cases related to the prostate, it appears as a pinkish tint, as if a single drop of red wine was mixed into a white sauce. It can also look brownish or rust-colored, which tells a doctor that the blood is older, that it has had time to oxidize, suggesting the source may be deeper inside within the prostate gland or the seminal vesicles. The amount can vary wildly. It can be a trace amount one time and then nothing for weeks, and then a more significant amount the next. This inconsistency is one of the reasons it's so easy to dismiss. A man sees it once, gets a fright, but then it's gone the next time, so he breathes a sigh of relief and tells himself it was a one-off anomaly. But that's a dangerous gamble. The price you pay for that gamble is time, and in medicine, time is the single most precious currency we have. When you see this sign, your mind will naturally want to find an innocent explanation, and frankly, sometimes there is one. But allowing yourself to believe the innocent explanation without confirming it is a mistake men pay for every single day in clinics across the country. I want you to understand the mechanics of it. Your semen is a complex fluid. It's produced by several glands, but the two main contributors are the prostate gland and the seminal vesicles, which are two small glands located just behind the prostate. The fluid travels through a series of ducts, mixing together before being ejaculated through the urethra, the same tube that carries urine. Blood can enter this pathway at any point. A tiny, fragile blood vessel in the prostate could rupture. An inflammation in the seminal vesicle could cause a small bleed. An issue in the urethra itself could be the source. The color, as we discussed, gives us clues about where the problem might be lurking. But here's the crucial part. You are not equipped to make that diagnosis yourself. Seeing blood is not a moment for self-diagnosis. It is a moment for action. Let's go back to Robert. He was a retired engineer, a logical man who believed in cause and effect. When he first saw that pinkish tinge, his logical mind immediately fought against the fear. He told me his internal monologue went something like this. I feel fine. I have no pain when I urinate. I'm as active as I was last year. Therefore, this must be nothing. It's an error in the system, not a critical failure. He clung to the absence of other symptoms as proof of his own wellness. The second time he saw it, the color was darker, more like rust. The fear was stronger, but so was the denial. He started avoiding intimacy with his wife, not because he didn't desire her, but because he was terrified of what he might see. He was afraid of her seeing it. The secret began to build a wall between them. He became irritable and withdrawn. The price he paid wasn't just physical, it was emotional. He carried this silent, heavy burden for nearly 8 months. 8 months in which the treatable, manageable condition inside him was given a precious head start. The price they paid, men like Robert, is measured in lost time, in more difficult treatments, and in the profound, gut-wrenching regret of knowing they had a chance to act sooner and didn't. His first words to me when he finally broke down and told me the whole story were, "I just feel so stupid. I knew something was wrong." My advice to him, and my advice to you, is to replace that feeling of fear or stupidity with one of empowerment. Your body talked to you. Now your job is to listen and translate. Don't panic, but do not delay. Your first step is to observe. Write it down. The date, the color, the amount. Note any other symptoms, even if they seem unrelated. Then, make the call. Schedule an appointment with your family doctor, or preferably, a urologist. Now, it's absolutely essential that we discuss the next point, because the goal here is not to create panic, but to create awareness. Seeing blood in your semen does not automatically mean you have cancer. In fact, in men under 40, it's almost never cancer. But we're talking about men over 60, and in this age group, the landscape changes. We have to be more vigilant. There are several potential causes for hematospermia, and we can broadly divide them into 2 categories: the more common, often benign causes, and the less common, but more serious warnings. Understanding both is key to having a calm, intelligent conversation with your doctor. On the benign side, One of the most frequent culprits is an infection or inflammation of the prostate gland, a condition called prostatitis. This is incredibly common in men of all ages, and it can cause swelling and irritation that leads to minor bleeding. Often, prostatitis comes with other symptoms like painful urination, a feeling of urgency, or a dull ache in the pelvic area, but sometimes hematospermia can be the only sign. Another common benign cause can be vigorous sexual activity or masturbation, which can sometimes rupture a tiny blood vessel. This is usually a one-time event and nothing to worry about. Medical procedures can also be a cause. If you've had a recent prostate biopsy, for example, it is almost expected that you will see blood in your semen for several weeks afterward. The same can be true after a vasectomy or other urological surgery. But then we have to turn our attention to the more serious possibilities, because while you can hope for a benign cause, you must be prepared to investigate a serious one. Persistent hematospermia, especially in a man over 60, can be a warning sign for prostate cancer. I must be clear here, it is not the most common symptom of prostate cancer. Most early-stage prostate cancers present with no symptoms at all, or with urinary symptoms like a weak stream or frequent urination. However, when hematospermia does appear, it must be taken seriously as a potential piece of the cancer puzzle. It tells us that something inside the gland is irritated, bleeding, or growing in a way that it shouldn't be. It can also be a sign of cancer in the bladder or the urethra, though this is less common. The price of assuming it's just prostatitis without getting it checked is potentially missing the crucial window for early detection of a cancer. Early-stage localized prostate cancer has a nearly 100% 5-year survival rate. The treatments are more effective and far less damaging to your quality of life. Once it has spread, that picture changes dramatically. It is a price no man should have to pay for the sake of avoiding a doctor's visit. High blood pressure, left uncontrolled, can also sometimes cause fragile vessels to rupture. And in some cases, it can be a sign of a sexually transmitted infection, which is why a full workup is so important. Your job is not to figure out which of these it is. Your job is simply to raise the flag. Now, while blood is the most dramatic and urgent signal, it's not the only piece of information your semen can provide. Let's broaden the conversation to its silent cousins, changes in consistency and volume. These are more subtle, but they can also be important indicators of your underlying health. For your entire adult life, you have a general sense of what is normal for you. When that normal begins to change in a persistent way, your body is trying to tell you something. Let's talk about consistency first. Healthy semen typically has a certain viscosity, a bit thick and gelatinous at first, becoming thinner and more watery after several minutes. If you notice a dramatic and lasting change, for instance, if it becomes consistently very watery, or conversely extremely thick, clumpy, or lumpy, it's worth paying attention to. Often these changes are related to simple factors. Dehydration can make semen thicker, as can the frequency of ejaculation. If it has been a while, it might be thicker. If it's your third time in a day, it will likely be more watery and translucent. This is normal, but a persistent change week after week could indicate an issue with your seminal vesicles or a sign of a low-grade infection. It could also be related to your diet. Your prostate requires certain nutrients, most notably zinc, to function properly and produce healthy fluid. A chronic deficiency could, over time, affect the quality of your semen. Perhaps even more significant is a noticeable and lasting change in the volume of your ejaculate. Again, volume can vary for many reasons, including your level of arousal and the time since your last ejaculation. But a consistent, significant decrease in the amount of fluid you produce is a signal you should not ignore. One of the primary medical concerns here is a condition called retrograde ejaculation. This is where all or some of your semen travels backward into your bladder instead of forward out of the urethra. You still have the sensation of an orgasm, but little to no fluid comes out. This happens because the small muscle at the neck of the bladder, which is supposed to slam shut during orgasm, doesn't function properly. What could cause this? For men over 60, the list of potential culprits is important. It's a very common side effect of certain prostate surgeries, like a TURP procedure for an enlarged prostate. It can also be caused by certain medications, particularly alpha blockers used to treat high blood pressure or urinary symptoms. And here's a critical link. It can be one of the early signs of nerve damage caused by uncontrolled diabetes. I had a patient, a wonderful man named Frank, a 72-year-old retired teacher. He came to see me because of urinary issues, but during our conversation, I asked him about his sexual health. He was hesitant at first, but then admitted that for the last year or so, he'd been having dry orgasms. He had completely written it off as just another unwelcome part of getting older. He told me, "Dr. Liam, the plumbing just doesn't work like it used to." I figured that was the end of that chapter. He had no idea it was a medical sign. After a few tests, we discovered he had raging, undiagnosed type 2 diabetes. The high blood sugar had been silently damaging the delicate nerves that controlled that little muscle in his bladder for years. The change in his semen volume wasn't just a sign of getting old. It was a critical warning from his body that his metabolic health was in serious trouble. We got him on a treatment plan for his diabetes immediately. We not only saved his kidneys and his eyesight from further damage, but we also managed to restore some of his normal function. Frank's story is a powerful reminder that these systems are all interconnected. A change in your sexual function is often a direct reflection of your overall cardiovascular, metabolic, and neurological health. Ignoring it is ignoring a vital piece of the puzzle. I want to pause here for a moment because this can be a lot of information to take in, and some of it is frightening. That's understandable, but I want to encourage you. The fact that you are watching this, that you are seeking this knowledge, already puts you light years ahead. You are choosing awareness over avoidance. And in that spirit of community and shared knowledge, I want to ask you to do something. In the comments below, without sharing any personal identifying information, feel free to share your questions. Perhaps you have a story about how paying attention to a small sign made a big difference. I read these comments. I use them to understand what your biggest concerns are, and I create more videos like this one to address them directly. You are not alone on this journey. So you've noticed something. Maybe it was a brownish tinge. Maybe it's a dramatic drop in volume. The initial feeling is often a jolt of cold panic. Your mind starts racing. What does this mean? Is it cancer? Is my life about to change forever? Let's shut that narrative down right now and replace it with a calm, logical, and proactive plan. This is what you do, starting this moment. Step 1 is to document. Do not rely on your memory. Get a small notebook or use the Notes app on your phone. Write down exactly what you saw. The date, the time, the color, the consistency, the volume. Write down any other symptoms you're experiencing, no matter how minor. Pain, burning, frequent urination, difficulty starting or stopping your stream, a new ache in your back. All of this is valuable data for your doctor. Step 2 is crucial. Do not spiral down the rabbit hole of late-night internet searches. Searching for your symptoms online will invariably lead you to the most terrifying, worst-case scenarios, causing you immense stress and anxiety that is not productive. The purpose of this video is to give you targeted, reliable information to prompt an action, not to send you into a panic. Step 3 is the most important action of all. Make the appointment. Call your doctor. When they ask what the appointment is for, you don't have to go into embarrassing detail with the receptionist. You can simply say, "I need to discuss a personal men's health issue," or "I need to schedule a urology consultation." When you get to the doctor's office, you can now be an active participant in your own care. You have your notes. You can say, "Doctor, on these dates, I noticed this change in my semen, and I am concerned." This is infinitely more helpful than saying, "I think something is wrong down there." Being specific helps your physician narrow down the possibilities much faster. So what should you expect at the visit? It's important to demystify this process. Your doctor will talk to you and take a detailed medical history. They will perform a physical exam, which will likely include a digital rectal exam, or DRE. This is a quick and painless procedure where the doctor feels the surface of your prostate gland with a gloved finger to check for any hard lumps, bumps, or irregularities. It's a vital tool. They will almost certainly ask for a urine sample to check for infection or blood. They will likely order a blood test called a PSA, or prostate-specific antigen test. PSA is a protein produced by the prostate, and a high level can be a marker for prostate cancer, but it can also be elevated by prostatitis or just an enlarged prostate. And depending on what they find, they may recommend an ultrasound, which uses sound waves to get a clear picture of your prostate and seminal vesicles. And here's the good part. The very act of taking these steps, of moving from a place of silent fear to proactive investigation, is incredibly empowering. Knowledge conquers fear. Whatever the answer is, whether it's a simple infection that can be cleared with antibiotics or something more serious that requires a treatment plan, knowing is always better than not knowing. The worst thing you can do for your health is to wait and worry. So let's bring this all together. For decades, men have been taught to be stoic, to push through pain, and to ignore the subtle whispers of their own bodies. But that approach is failing us. It is costing us our health, our vitality, and in some cases, our lives. Your body is constantly communicating with you, and your semen is a powerful, though often overlooked, messenger. The number one sign you must never, ever ignore after the age of 60 is seeing blood, be it red, pink, or brown. It is a direct signal that requires immediate professional attention. But don't stop there. Pay attention to the quieter signals too. A lasting, unexplained change in the consistency, or, just as importantly, a significant decrease in the volume of your ejaculate, can be early warnings of other underlying health issues, from infections to diabetes. Ignoring these signs is a gamble you can't afford to take. The price of silence is simply too high. But I want to end on a note of profound hope and empowerment. Noticing one of these signs is not a death sentence. It is not a diagnosis. It is an opportunity. It is your body's way of giving you a head start, a chance to be proactive, a chance to take control of your health narrative before a small problem becomes a large one. You have the power to change the outcome. You have the power to turn fear into action. The men who live the longest, healthiest, and most vital lives are not the ones who never have health problems. They are the ones who listen to their bodies and act swiftly and intelligently when a warning sign appears. So my final call to action for you today is not just about your physical health, but about a change in mindset. Make a promise to yourself right now that you will no longer be embarrassed or afraid to look at and listen to your own body. Your one small, impactful step today is to abandon the code of silence. Join this community of men who are choosing to be informed, proactive, and in control. Subscribe to the channel, click the like button if you found this information valuable, and hit that notification bell so you are with us for the next crucial conversation. Your health is your greatest wealth, and it's time to protect it.